examination of elbow joint is the same. Is the same like shoulder joint or any joint. Wash, permission, explain, position of the patient, sitting or standing, and stand in front of the patient, and good exposure of both upper limb for comparison between the two limbs. By inspection, tell me about the point of maximum pain. Okay, this is called pointing sign. Then, by comparison between the both sides anteriorly and posteriorly, there is no deformity, no swelling. The skin surrounding the joint is normal, with no redness, no scar of previous operation, no evidence of trauma, no discharging signs. The muscles are equal and normal on both sides, with no disuse atrophy. And the most important is active movement. Please do like that. Flexion, normal range, equal on both sides, no limitation of movement, no pain. The normal range of flexion is about 140 to 150. Please make the elbow like that. This extension. What is the normal range of extension? 0 degree. Because this is the anatomical position, which is the 0 of all joints. Palpation, 2T. Temperature, anteriorly and posteriorly. Normal skin temperature to exclude hotness of acute suburative arthritis or any inflammation. Tenderness on both sides, starting with the normal. Palpate anteriorly. Look to the facial expression of the patient, anteriorly and posteriorly. No tenderness. Put the left hand on the joint and the right hand move the elbow joint of the patient. This is called passive movement. No crepitus. Then push my hand, flexion of elbow. Push my hand, extension of the elbow for the motor power. And compare both sides, equal motor power, equal on both sides. Then, no swelling, and examine all other structures in the limb. Here or other structures in the limb, the elbow joint anteriorly there is brachial pulsation, distally radial pulsation to exclude vascular diseases. Because stiffness of joints may be not a disease of joint. Stiffness of joint may occur in long-standing severe ischemia. You know what is called Volkmann's ischemic contracture? There is a very severe ischemia in the upper limb leading to what's called Volkmann's ischemic contracture. Stiffness of joint due to fibrosis and stiffness of joint due to severe ischemia. The limitation of movement in the elbow may be due to ischemia. Okay? As a routine, examine all other joints to exclude radiating pain from other joints. Examination of nerves because the elbow is surrounded by ulnar nerve, medial nerve, radial nerve. We should examine sensation and motor activity to exclude radial, medial, ulnar nerve injuries. Okay? This is the palpation of the elbow joint. In any other joints, the same points, but the difference always in the motor activity. What is the movement in the wrist? If you want to examine the wrist, the same as the general scheme, but please make your hand like that. Flexion of the wrist, like that. Extension of the wrist, like that. Adduction, or what is called the ulnar deviation, like that. Abduction, or what is called radial deviation. If you want to examine the metacarpophalangeal joint and the joints of the thumb, the same scheme. What are the movements of thumb? Compare bilaterally as usual. Put your hand like that. Point by the thumb upward. This movement is called abduction of the thumb. Let the thumb lie down in front or by the side of the index. This movement is called adduction. Let the thumb point laterally. This is called extension. Let the thumb point medially on the palm of the hand. This is called flexion. Let the thumb point on the other fingers. This is called opposition. And do like that, which is called circumduction. What are the movements of metacarpophalangeal joint? Flexion and extension. Never forget abduction and adduction, which should be done at a level of a table. Abduction and adduction of the finger should be done on a flat surface. Interphalangeal joints. What's the movements of interphalangeal joints? Fix the middle phalanx. Flex your finger. This is flexion of the terminal phalanx, which is flexion of the distal interphalangeal joint. Okay. Flexion of the middle phalanx and proximal interphalangeal joints. Okay. Therefore, there is a general scheme for examination of joint: inspection, pointing sign, swelling, deformity, active movement, skin and muscle surrounds the joint. By palpation, temperature and tenderness, 2T, plus 2 movement, passive movement and motor power. Motor power is active movement against resistance, plus swelling and the examination of all other structures in the limb. Palpation can be summarized in 2T, 2 movements, and 2S, swelling and surrounding structure. 2T, 2 movement, and 2S, swelling and surrounding structure. This is examination of joints of the upper limb.